State of Cannabis.
This is the State of Cannabis News Digest, a roundup of this week's key developments in the cannabis industry.
In Colorado, Delaware, and Hawaii, lawmakers are pushing to expand compassionate access, moving closer to allowing some terminally ill patients to use medical cannabis inside hospitals, hospice care, and other health facilities. In Connecticut and Minnesota, the focus is on the rules of a maturing market, from tighter testing and delivery standards to new state tribal agreements that could shape how cannabis is regulated and sold. Elsewhere, the fight is shifting to hemp and THC drinks. Kentucky, Ohio, South Carolina, and Texas are all weighing, or already imposing, new taxes, lawsuits, sales limits, and testing rules that could redefine what stays on shelves, who can sell it, and how consumers get access. And in Nebraska and Tennessee, the bigger political questions remain in view. How far states can go, how fast reform should move, and what happens when state ambitions collide with federal uncertainty. Stay with us. Ahead, the details behind the legislation, the legal battles, and the policy shifts reshaping cannabis across the country. If you're new here, subscribe to be notified when the new news episode posts. And if you're already a weekly listener, hit that like button.
And now here is the deeper look at the key events in the cannabis world this week.
We begin with a cluster of stories that point in the same direction. Cannabis policy moving deeper into healthcare itself. For years, many state medical marijuana laws gave patients legal access in theory, but not necessarily in the places where some of the sickest patients actually receive care. Hospitals, hospice centers, and nursing facilities. Now, several states are trying to change that. First, to Colorado.
Colorado is moving closer to allowing terminally ill patients to use medical marijuana inside healthcare facilities. Lawmakers have passed SB 26007, sending the measure to Governor Jared Polis for consideration. The bill would permit hospitals and similar facilities to allow cannabis use for registered medical marijuana patients nearing the end of life. Under the proposal, healthcare institutions would have discretion over whether to participate. Facilities that do take part would have to create internal policies covering how cannabis is stored, administered, and monitored. The legislation also includes liability protections, and it allows facilities to suspend compliance if federal regulations change or if federal funding is placed at risk. Supporters describe the measure as a step toward compassionate care, giving patients another option for pain management. Some advocates, though, say the fact that participation is optional could create uneven access, depending on where a patient is receiving treatment. If Governor Polis signs the bill, SB 26007 could help define how medical cannabis is integrated into clinical settings in Colorado, shaping both patient experience and healthcare policy in the state's evolving cannabis system.
Delaware lawmakers are considering a similar question, with a narrower focus. A proposed change to the state's medical cannabis system is moving through the legislature. Senate Bill 226 has passed the state Senate after earlier approval by the Health and Social Services Committee. The measure is designed to allow terminally ill patients to use medical marijuana while receiving care in licensed acute care hospitals. Supporters say it addresses a gap in Delaware's medical marijuana program, which has existed since 2011 but has not explicitly protected patients' rights to use cannabis in institutional settings. Under the proposal, patients and caregivers would be responsible for obtaining and administering the medication, storing it securely, and informing attending physicians about its use. Hospitals would be required to document cannabis use in medical records and develop internal policies for staff and patients. Smoking and vaping would not be allowed in hospitals, so patients would have to rely on other methods of consumption. Facilities could still restrict use if cannabis is considered medically inappropriate or if federal agencies issue directives against it. Patients in emergency departments would not be covered under the policy. The bill's progress comes as Delaware continues adjusting to a broader cannabis market that has expanded since adult use sales began in 2024. Lawmakers are also reviewing zoning restrictions, public consumption penalties, and market access concerns. If the House approves the measure, it would mark a targeted expansion of medical cannabis access in end-of-life care, while preserving clinical oversight and compliance safeguards.
In Hawaii, the legislature is also moving on a compassionate access measure, but with a somewhat broader scope. The state Senate has approved Senate Bill 2408, known as the Compassionate Access to Medical Cannabis Act. The proposal would allow terminally ill patients and certain older patients with chronic conditions to continue using prescribed cannabis during institutional care. Under the bill, hospitals, hospice homes, and skilled nursing facilities could adopt policies allowing cannabis use, though smoking and vaping would still be restricted. Patients or caregivers would be responsible for obtaining and administering the medication. Facilities would need to document its use and create internal guidelines for staff. Like the proposals in other states, Hawaii's bill addresses federal legal uncertainty directly. Facilities could suspend participation if federal authorities take enforcement action or issue guidance prohibiting cannabis use. Some settings would remain off-limits, including emergency departments and substance misuse treatment environments. The measure reflects Hawaii's continued focus on targeted medical cannabis policy changes, even as broader legalization proposals have struggled to advance. Lawmakers have also been working through issues involving caregiver cultivation rules, hemp product regulations, and expungement procedures. If the bill becomes law, its practical effect may depend heavily on whether individual facilities choose to participate. But for patients in extended care, it could provide a clearer path to treatment continuity. If the House approves the measure, it would mark a targeted expansion of medical cannabis access in end-of-life care while preserving clinical oversight and compliance safeguards.
Taken together, the stories out of Colorado, Delaware, and Hawaii show the same policy shift from three different angles. The debate is no longer only about whether patients can legally possess medical cannabis. It is increasingly about whether they can keep using it once they enter the medical system, and whether hospitals and care facilities are willing to make room for it. From there, we move to a different stage of cannabis policy. What happens after legalization or commercialization is already underway? In Connecticut and Minnesota, the central question is not access alone. It is governance, testing, delivery, oversight, and who gets regulatory authority.
Connecticut's cannabis industry may soon face a new set of operational standards as lawmakers consider Senate Bill 231. The proposal has already received unanimous approval from the legislature's Joint Committee on General Law. Introduced earlier this year, it reflects recommendations from the state's Department of Consumer Protection. If enacted, the bill would require cannabis businesses to submit product samples for laboratory testing under updated state standards. Batches that fail would need to be retested or remediated within a limited time, or else be disposed of. For consumers, that could mean a stronger emphasis on consistency and safety. For operators, it could also mean higher compliance costs. The measure would also expand delivery authority, allowing dispensary facilities, hybrid retailers, and certain micro-cultivators to transport cannabis products within existing legal frameworks. That shift could improve access for medical patients and caregivers, especially in less urban areas. Another important provision deals with pharmacist staffing. The bill outlines a hybrid model that would require a licensed pharmacist to be physically present for part of the week, while allowing telehealth consultations and remote dispensing during other hours. That approach could broaden patient access to professional guidance, though it also raises questions about how care delivery changes when more of it moves into digital settings. The proposal contains other technical revisions as well, including provisions related to electronic nicotine delivery system dealer registrations. But its broader significance lies in how Connecticut is continuing to refine its cannabis regulatory structure as the market matures. What lawmakers decide next will shape how quickly those changes reach consumers and businesses.
Minnesota's latest cannabis story is less about product standards and more about regulatory power. State officials have finalized a new cannabis compact with the Lower Sioux Indian community, part of a broader strategy to coordinate cannabis regulation with tribal nations across the state. The agreement was signed by Governor Tim Walz and the Office of Cannabis Management. It reflects state law directing officials to negotiate cooperative frameworks that prioritize public health and safety. Under the compact, tribal cannabis operators can conduct business beyond tribally regulated lands while remaining under oversight by tribal regulatory agencies. Those agencies are responsible for licensing enterprises and enforcing standards that meet or exceed state requirements. State and tribal leaders describe the agreement as a step toward building a mature cannabis industry that balances economic development with consumer protections. Minnesota has entered into similar agreements with several other tribal nations, signaling an ongoing reliance on intergovernmental cooperation as the market develops. For consumers and businesses, that structure may influence how cannabis products are tested, distributed, and regulated statewide. And as more compacts are negotiated, Minnesota's regulatory map may continue to evolve.
Kentucky lawmakers are reviewing House Bill 9, a sweeping proposal that could reshape how cannabis-infused beverages and alcohol are taxed and regulated. Introduced in March 2026, the bill would impose a 4% state retail regulatory license fee on these products, along with new wholesale fees for kratom, hemp-derived, and cannabinoid goods. The measure would phase out existing excise and wholesale taxes by July 1st of 2027, replacing them with a unified licensing fee system. It also sets laboratory testing standards for the Department for Public Health and makes changes to alcohol licensing rules, including new categories and updated enforcement provisions. Local governments would still be allowed to impose regulatory license fees, but those fees would face limits and would have to be reduced over time. The bill also includes oversight mechanisms, including audits of municipal funds. For businesses in Kentucky's emerging hemp and cannabis beverage sectors, the proposal could affect compliance strategies, pricing, and long-term planning. Some provisions could take effect immediately under emergency clauses, while the broader tax restructuring is scheduled for mid-2027.
In South Carolina, lawmakers are considering a bill that would regulate hemp-derived THC beverages through a framework that resembles alcohol law. The proposal, H. 3924, comes as the state's hemp beverage market continues to grow, and lawmakers argue that current regulations leave major gaps. Under the bill, grocery and convenience stores would be allowed to sell beverages containing up to 5 milligrams of THC per serving. Stronger products containing up to 10 milligrams of THC would be limited to liquor stores. Restaurants and bars would not be allowed to sell THC beverages under the current version of the proposal. The bill also creates licensing requirements, testing standards, and labeling rules. Sales would be limited to people 21 and older. In addition, it would prohibit synthetic cannabinoids, including Delta-8 and Delta-10 THC, and it includes a controversial ban on THC-infused gummies. Debate is continuing in the South Carolina Senate, where lawmakers from both parties have indicated they may want to amend parts of the bill before it moves forward. The outcome could help determine how South Carolina regulates hemp-derived cannabinoids as that market expands nationwide.
In Ohio, the fight over THC beverages has already moved into court. The state's brewing industry is challenging a looming ban on hemp-derived THC drinks, with several companies filing a lawsuit against the state. The dispute centers on Governor Mike DeWine's veto of parts of Senate Bill 56, legislation that revised marijuana, hemp, and liquor laws after Ohio voters approved adult-use cannabis in 2023. Before the veto, the bill had included a transition period that would have allowed breweries and retailers to continue selling THC-infused drinks while adapting to new regulations. The companies bringing the lawsuit argue that cutting that timeline short exposes them to enforcement risks and financial losses, including layoffs tied to inventory they may no longer be able to sell. State officials, for their part, argue that Ohio voters did not explicitly approve THC beverages in hospitality settings. The Ohio Supreme Court has set a deadline for officials to respond to the emergency motion, signaling a fast-moving legal battle. The case underscores a broader question now facing many states: how hemp-derived products fit into cannabis systems that were designed with other categories in mind. For businesses, consumers, and policymakers, the result in Ohio could influence future market rules and future legislative negotiations.
And in Texas, regulators have now finalized a major overhaul of hemp rules. The new framework lowers some barriers while tightening others. It reduces licensing fees for parts of the industry, but it also imposes stricter testing standards based on total THC. That matters because the revised standard includes not only delta-9 THC, but also precursor compounds such as THCA. Industry groups warn that many products that currently comply with federal hemp definitions may fail under the new standard, which could significantly affect supply and business operations. The rules add new requirements for labeling, record-keeping, and laboratory verification. At the same time, Texas is preparing for an especially significant retail change. Smokable hemp products must be removed from store shelves by March 31st. That follows an executive directive from Governor Greg Abbott after lawmakers failed to reach agreement on THC policy during recent legislative sessions. Because THCA converts into delta-9 THC when heated, products such as hemp flower and some extracts will no longer qualify for legal sale under the updated rules. Edible hemp products will still be allowed, but they will have to meet stricter packaging and testing requirements. Industry groups argue the product restrictions and licensing structure could reduce legal access and push some businesses out of the market. Policy advocates warn that consumers may turn to unregulated or out-of-state sources if legal options narrow. In one of the country's largest consumer markets, Texas is effectively testing how far a state can go in narrowing hemp commerce without shutting it down entirely.
As we wrap up the week, we look at two states where the biggest story is not just the policy on paper, but the larger political test behind it. In Nebraska, the challenge is federal uncertainty. In Tennessee, it is whether a legalization push can gain traction in a state where adult-use marijuana remains illegal.
Nebraska's new medical cannabis program is moving forward without the federal protections that have shielded most state systems from enforcement since 2014. Congress recently updated its list of covered states, but Nebraska was not included, even after voters approved measures in 2024 legalizing medical marijuana possession and creating a regulatory commission. During a recent press call, Senator Pete Ricketts noted that marijuana remains a controlled substance under federal law, and he did not directly say whether he would support adding Nebraska to the non-interference list. Advocates say that omission could create uncertainty for patients, caregivers, and potential businesses as Nebraska works to implement its medical cannabis framework. The situation highlights one of the oldest unresolved tensions in American cannabis policy. States may legalize or regulate cannabis, but federal law still shapes risk, financing, oversight, and enforcement. As debates continue in Washington over classification and enforcement, Nebraska's program may take shape under legal conditions that remain unsettled.
In Tennessee, lawmakers are once again pushing a broader reform effort through the Pot for Potholes Act. The proposal, led by Senator Heidi Campbell and Representative Afton Bain, would legalize adult-use marijuana and direct cannabis tax revenue toward transportation and infrastructure projects. Supporters have also launched a public campaign to build momentum behind the measure. Under the proposal, adults 21 and older would be allowed to possess up to 60 grams of marijuana and cultivate a limited number of plants for personal use. The bill would also create a regulatory framework for cannabis businesses, overseen by the Tennessee Department of Agriculture. Marijuana sales would be taxed at 15%, with most of the revenue going to the State Highway Fund. Other revenue would be allocated to counties, administrative costs, and community reinvestment programs. Supporters argue the plan could help address infrastructure funding needs while capturing economic activity that is already crossing state lines. The measure follows a similar effort that failed to advance in the previous legislative session, and it arrives in a state where recreational marijuana remains illegal. So in Tennessee, the question is not only whether legalization is possible, it is whether a message built around roads, revenue, and neighboring state competition can move the political needle.
Taken together, this week's stories show a cannabis landscape that is getting more complicated, not less. Some states are trying to expand compassionate medical access for patients at the end of life. Some are tightening market rules as legal systems mature. Some are wrestling with hemp-derived THC and drinks that do not fit neatly into older regulatory models. And some are still confronting the basic political and federal questions that have hovered over cannabis policy for years. What unites all of these stories is this: the next phase of cannabis reform is no longer just about legalization. It is about administration, enforcement, healthcare, taxation, jurisdiction, and the limits of state power. That's our roundup for this week. If you found this episode helpful, hit like, and if you haven't subscribed yet, be sure to subscribe so you don't miss our next update.